Right now, if you're over 60, there's a very good chance your body is short on one particular mineral and you have no idea.
Because the shortage doesn't announce itself the way a headache does or a fever does. It shows up quietly as a number on a blood pressure cuff that keeps creeping upward no matter how carefully you've been cutting back on salt. Here's a number I want you to sit with for a second. The committees that write the official U.S. dietary guidelines, the people whose entire job is to look at what real adults actually eat, meal by meal, across tens of thousands of households, have flagged one particular nutrient as a nutrient of public health concern. That's the technical language for almost nobody is getting enough of this, and it's affecting real health outcomes at scale. That nutrient is not sodium, it's not vitamin D, it's potassium. And if you've spent years being told that blood pressure is a subtraction problem, less salt, less bacon, less canned soup, I am about to show you the other half of that equation. The half almost nobody explains to you at your annual checkup, because a 15-minute appointment barely has time to cover your medications, let alone the chemistry happening inside your blood vessels every single day. Stay with me all the way to the end of this list, because the food sitting in the number one position is something most people over 60 have been quietly avoiding, for exactly the wrong reason. And once I explain why, I think you're going to feel a little bit frustrated that nobody told you sooner. My name is Dr. Seo. I've spent more than 15 years practicing internal medicine and studying nutritional biochemistry, which in plain terms is the science of what food actually does to your body at the level of cells, membranes, and blood vessels, long before any of it shows up as a diagnosis on a chart. I'm not here to sell you a supplement, and I'm not here to scare you into some 12-week program. I'm here to walk you through the research on one mineral and one number that matters more than almost anything else on your chart after 60, your blood pressure. So let's talk about what's actually happening inside your blood vessels right now while you're sitting there listening to me, because once you see this clearly, the rest of this video is going to make sense in a way no supplement label ever could. Picture your blood vessels not as rigid pipes, but as living, flexible tubes lined with a thin ring of muscle. That muscle can tighten, narrowing the tube and forcing the same amount of blood through a smaller space, which raises pressure. Or it can relax, widening the tube, letting that same blood move through with far less force. Now, every single one of your roughly 37 trillion cells has a tiny pump built into its outer wall, whose entire job around the clock is to push sodium out of the cell and pull potassium in. When that balance tips too far towards sodium, water follows it, your blood volume rises, your vessel walls stay tight, and your pressure climbs. When potassium is present in sufficient quantity, it does two things almost at once. It helps that ring of muscle around your vessels loosen its grip, and it signals your kidneys that it's safe to release the extra sodium you're carrying. You are not just managing salt, you are managing a ratio, and for most people past 60, that ratio is broken, not necessarily because they're drowning in sodium, though plenty are, but because the other side of the scale, the potassium side, is running nearly empty. So here is the one idea I want you to carry through the rest of this list, because every item is going to circle back to it. Almost every piece of blood pressure advice you've ever received has been about removal. Less salt, less processed meat, less soy sauce. Nobody hands you a list of things to add. I want you to hold 3 words in your head as we go: balance, relax, flush. Balance, because sodium and potassium work like a seesaw inside every one of your cells. Relax, because potassium helps loosen the muscle wrapped around your blood vessels. And flush, because potassium is the signal that tells your kidneys it's safe to let extra sodium go. Keep those 3 words close, because you're going to hear at least one of them in every single item on this list. I want to be honest with you about something here, because I think it matters. This isn't a Korean secret, and I'm not going to pretend it is. Korean researchers have actually spent decades studying this exact question, and for a fairly uncomfortable reason. Traditional Korean cuisine, with its fermented pastes and preserved vegetables, tends to run quite high in sodium. Rather than looking away from that, a lot of Korean public health research leaned directly into the problem, and much of it ended up focusing less on sodium in isolation and more on the ratio between sodium and potassium, because a diet can carry real salt and still protect blood pressure reasonably well, if it's also extremely rich in potassium-dense vegetables eaten in small portions throughout the day. That's the lens I'll bring to a couple of items on this list. Not Korean means safer. Just, this is a country that had to solve this exact seesaw problem out of necessity, and some of what they learned applies just as well in a kitchen in Ohio as it does in one in Seoul. And I'll say it plainly whenever it's true. Several of Korea's most iconic foods, its kimchi, its fermented soybean paste, carry meaningful sodium themselves. Traditional does not automatically mean gentle on your blood pressure. Keep that in mind, because I will not be shy about saying so when it applies. Alright, let's build this list. Number 8 is one almost nobody puts in the same conversation: blood pressure, because we've spent decades talking about it for your bones instead. plain yogurt. Here's why it earns a spot here. Most people think of dairy as a calcium story and stop there. But a cup of plain yogurt is quietly carrying 3 minerals that all lean on the same side of the seesaw: potassium, calcium, and magnesium. And large population studies looking at dietary patterns for blood pressure, including the well-known DASH eating pattern developed specifically to lower blood pressure, consistently include low-fat dairy as one of its core building blocks, alongside fruits and vegetables. 1 cup of plain yogurt carries somewhere close to 600 milligrams of potassium. That's more than a medium banana. The catch, and I need you to really hear this part, is that flavored yogurt cups, the ones with fruit on the bottom or caramel swirled through them, often carry as much added sugar as a candy bar, which undoes a good part of the benefit. So the action here is simple. Buy it plain and add your own fruit. A handful of berries costs you almost nothing in sugar and adds even more potassium on top. Number 7 is the one people already think of as healthy, but almost never connect to this specific mineral: avocado. Here's the part that surprises people. Avocado gets talked about constantly for its fat, and that fat is genuinely good, mostly the monounsaturated kind that behaves well for your heart. But sitting right alongside that fat is a serious potassium payload, plus a meaningful amount of magnesium, and magnesium works almost like a partner to potassium in that relax mechanism I mentioned earlier. It helps the same vessel wall muscle loosen. A single avocado carries somewhere between 700 and 900 milligrams of potassium, which puts one piece of fruit ahead of almost anything else you'll find in a produce aisle. So what should you do? A quarter of an avocado, mashed onto whole grain toast or folded into eggs a few mornings a week, is a small habit that adds up fast, and it does it without adding a single milligram of sodium. Number 6 might be the least glamorous item on this entire list, and that's exactly why it's here. White beans. Cannellini. Great Northern, navy beans, the beans that show up in soup and get quietly pushed to the side of the bowl. People think of legumes as a starch, a filler, and completely miss that they're one of the densest whole food sources of potassium you can buy for a few dollars a bag. There's also a secondary story here worth mentioning honestly. White beans are loaded with fiber, and some emerging research suggests the compounds your gut bacteria produce when they break down that fiber may play a supporting role in how your blood vessels function. I want to be careful with that claim. This is an active and still developing area of research, not a settled fact. So think of it as a bonus, not the headline. The headline is the number. 1 cup of cooked white beans carries close to 1,000 milligrams of potassium, more than 2 bananas, in a bowl of something that costs you almost nothing. Toss half a cup into any soup, stew, or pasta sauce you're already making, and you've added a meaningful dose without changing your meal at all. Now, numbers 5 and 4 are the two I think most people get completely wrong. 1 because they've been taught to fear it, and 1 because they simply never think of it as a mineral source in the first place. If a video like this is genuinely useful to you, this is the moment where hitting subscribe means I keep making them, and I genuinely appreciate it. Now, let's keep climbing. Number 5 is one that hides in plain sight in almost every pantry: tomato paste and concentrated tomato products more broadly. A fresh tomato is a perfectly fine source of potassium, but nothing remarkable. The moment you cook it down and remove most of the water, though, everything left behind becomes far more concentrated, including the potassium. 2 tablespoons of tomato paste, about what goes into 1 real batch of pasta sauce, carries somewhere around 300 milligrams of potassium, packed into almost nothing. There's a small bonus here too. Tomato paste is also rich in lycopene, an antioxidant compound that's been studied for its own separate cardiovascular interest, though I won't overstate that piece. It's a supporting actor, not the star of tonight's list. Here's the practical catch though, and it matters. A lot of jarred pasta sauces built from that same tomato base are loaded with added sodium to compensate for flavor. So the action is to buy plain, no salt added tomato paste and build your own sauce from there, seasoning it yourself. You keep the potassium, and you control the sodium side of the seesaw at the same time. Number 4 is the one I promised you at the start of this video. The food most people over 60 have been quietly avoiding for exactly the wrong reason: the baked potato, skin on. I need you to really sit with this one because I think it's the single most common mistake I see in patients trying to eat better for their blood pressure. Somewhere along the way, the potato got lumped in with carbs to avoid, especially for anyone watching their blood sugar, and so people peel it, boil the potassium straight down the drain with the peel, or cut it out entirely. But here's the truth. A large share of a potato's potassium sits directly under and within that skin. A medium potato, baked skin left on, carries somewhere around 900 milligrams of potassium, more than any other single item on this entire list, more than double a banana. And here's a piece of nutritional biochemistry that I think genuinely changes how you should think about this food. If you cook a potato and then let it cool completely in the refrigerator before reheating it, some of the starch inside physically changes structure. It converts into what's called resistant starch, which your body handles much more like fiber than like sugar, blunting the blood sugar spike you'd normally get from eating it hot and fresh. So the action here is 2 steps. eat the skin. And if you're managing blood sugar, cook your potatoes a day ahead, chill them overnight, and reheat gently the next day. Same food. Meaningfully gentler on your glucose. Number 3 surprises people for a completely different reason: salmon. Almost everyone I talk to assumes potassium only lives in fruits and vegetables, and completely misses that a serious protein source can carry a real dose of it too. A 3-ounce piece of salmon, roughly the size of a deck of cards, carries somewhere between 400 and 600 milligrams of potassium, with wild varieties like sockeye typically running higher than farmed. And it comes bundled with omega-3 fatty acids, which have their own well-studied separate role in supporting heart and vessel health. So this is one of the rare items on the list doing genuine double duty. The action is straightforward. Aim for salmon, or a similar fatty fish, roughly twice a week, which lines up with standard cardiology guidance already. If you're using canned salmon for convenience, leave the small, soft bones in. They add calcium on top, but do check the label for added sodium, because canned and smoked versions vary widely. Number 2 is, I think, the most underrated leafy green in the entire produce section: Swiss chard. Spinach and kale get all the attention, and they're both genuinely good choices, but chard quietly outperforms them on this specific measure. 1 cooked cup of Swiss chard carries close to 960 milligrams of potassium, putting it near the very top of anything you'll find growing out of the ground. Here's why cooking it matters so much for this particular mineral. A raw cup of leafy greens is mostly water and air by volume. Cook it down, and that volume collapses while the mineral content stays essentially the same, so what you're eating becomes dramatically more concentrated. Balance and flush, both at once, in a 5-minute sauté. The action is simple: a quick sauté with a little olive oil and garlic. 5 minutes, done. If the flavor is too sharp for you raw or lightly cooked, a brief blanch in boiling water for 60 seconds before you sauté it softens the bitterness considerably. And now, number 1, the food I teased you about at the very beginning of this video: sweet potato. Here's why this belongs at the top, and why I think most people over 60 have been avoiding it for exactly the wrong reason. Just like the white potato, the sweet potato got swept into the same carbs to cut conversation, and people who are otherwise trying to eat carefully skip right past it. But a medium sweet potato skin on carries around 540 milligrams of potassium, solidly ahead of a banana, along with meaningful magnesium and fiber, plus beta-carotene, which your body converts into vitamin A genuine bonus, even though that's a separate story from blood pressure, and I don't want to blur the two together. Here's where I'll bring back that Korean lens one more time, because it's honestly earned at this point in the list. In Korea, the sweet potato, goguma, isn't a special occasion food. It's an everyday staple: roasted, steamed, sold on street corners in winter, eaten the way you might eat toast. And some of the same Korean nutrition research I mentioned earlier, the work built around the sodium-potassium ratio, has looked specifically at humble root vegetables like this one as a practical, inexpensive way to push that ratio back into balance, without asking anyone to overhaul their entire diet. Not a superfood, not a secret, just a genuinely potassium-dense, everyday food that a lot of people in the West have been quietly steering away from. It's not the salt, it's the balance. I want you to remember that line, because we're about to talk about what happens when someone actually puts it into practice. Let me tell you about a patient I'll call Grace, because the details are changed, but the pattern is one I've watched play out many times. Grace was 68, on 2 blood pressure medications, and had spent almost a decade doing everything she'd ever been told to do: reading sodium labels obsessively, cutting out deli meat, rinsing canned vegetables at the sink. Her numbers had improved from where they started years earlier, but they had plateaued at a level her doctor still wasn't happy with, and she was frustrated, because she felt like she was doing everything right and getting punished for it anyway. When we talked, I didn't ask her to cut anything else out. I asked her what she was adding, and the honest answer was almost nothing. Her plate was defined entirely by absence. So we built a very small, very boring routine: beans in her soup a few nights a week, a sweet potato instead of white rice at dinner, plain yogurt instead of her usual sweetened one at breakfast. Nothing dramatic. 4 months later, at a routine follow-up with her own physician, her numbers had come down enough that her doctor felt comfortable reducing one of her 3 medications under close supervision. Grace told me it was the first time in years that eating for her blood pressure had felt like something she was adding to her life, instead of one more thing being taken away from it. I share that story not as a promise. Everyone's body, medications, and kidney function are different, but because it shows you exactly what the addition side of this equation can do when you finally give it room to work. So how do you actually build this into a real week, without turning your kitchen into a laboratory? Here's the routine I give patients, and I want you to picture it as one simple plate, rather than 8 separate rules. Call it your potassium plate. A few nights a week, put half a cup of white beans, a handful of sautéed Swiss chard or another leafy green, and half a baked sweet potato with the skin on, all together on one plate, alongside whatever protein you're already having. That single plate, on its own, is carrying somewhere in the neighborhood of 2,000 milligrams of potassium, more than half of what most adults need in an entire day, from 3 ingredients that together cost less than a fast food meal. You don't need to hit every item on this list every day. You need this plate to show up 2 or 3 times a week, consistently for months, because blood pressure responds to patterns, not to a single good Tuesday. And here's the one habit I'll borrow directly from that Korean lens I mentioned earlier, because I think it genuinely fits this particular problem. In Korea, meals are traditionally built around banchan, small side dishes of seasoned, often blanched vegetables that appear at nearly every meal, breakfast included, not just dinner. The effect of that habit isn't one large potassium dose once a day. It's a small, steady drip of it, meal after meal. You don't need to cook Korean food to borrow that pattern. You simply need a small side of vegetables at breakfast and lunch, not only at dinner, which is where most of us confine our vegetables entirely. Spreading the intake out, rather than loading it all into one meal, is a small shift that makes a real difference over time. Now, I need to give you the honest limits of everything I've just told you, because naming them is exactly what makes this trustworthy, rather than a sales pitch. This is general educational guidance, not personalized medical advice for your specific situation. If you have chronic kidney disease, or if you're on dialysis, please hear this clearly. Damaged kidneys often can't clear potassium properly. And for you, too much potassium isn't a minor issue. It can affect your heart's rhythm and become genuinely dangerous. If that's your situation, potassium is very likely something your nephrologist wants you to limit, not add. And nothing in this video should override what they've told you. Please talk with them before changing anything. The same caution applies if you're taking an ACE inhibitor, an ARB, or a potassium-sparing diuretic like spironolactone. These medications already raise your blood potassium as part of how they work, which means stacking a large dietary increase on top, or reaching for a light or low-sodium salt substitute, which is almost always just potassium chloride in disguise, can push your levels higher than is safe. If you're on any of those medications, ask your doctor directly whether the changes I've described tonight are appropriate for you, and consider requesting a basic metabolic panel at your next visit. It's a simple, inexpensive blood test that shows your potassium, your sodium, and how well your kidneys are functioning. And it's the single best way to know exactly where you stand before you change anything. I also want to be clear about something I did not say tonight and won't say. Nothing in this video is a reason to stop, skip, or reduce any blood pressure medication on your own. Grace's medication was adjusted by her own physician, watching her numbers over months, not by Grace deciding on her own that food had replaced her prescription. Food and medication work together here, not against each other. And in general, I'd rather you get potassium from food than from a supplement pill. Food comes with fiber and water that slow how quickly it's absorbed, which is part of why the food-first approach is generally considered the safer path for most people, while concentrated supplements deserve a conversation with your doctor first. Let's bring this all the way back around, because I want you to walk away with something you can actually use tonight, not just remember. Plain yogurt, swapped in at breakfast, for the calcium, potassium, magnesium trio the DASH pattern is built on. Avocado, a quarter at a time, for its potassium and vessel-relaxing magnesium. White beans, half a cup at a time, for one of the cheapest potassium doses on the planet. Tomato paste, no salt added, for a concentrated hit in almost nothing. The baked potato, skin on, cooled and reheated if you're managing blood sugar. Salmon, twice a week, doing double duty for your heart and your minerals. Swiss chard, quickly sautéed, for the densest common leafy green you'll find. And sweet potato, the one you were probably avoiding for the wrong reason, sitting right at the top for a reason. If you only start with 2 or 3 tonight, make it the plain yogurt, the white beans, and the sweet potato. They're the cheapest, the easiest to find, and the fastest to fold into a meal you're already making this week. It's not the salt, it's the balance. Salt gets almost all of the headlines every single time this topic comes up, but your blood pressure has been listening to a second voice this entire time, one that's been getting a lot quieter for a lot longer than most people realize. I'd genuinely like to know which of these surprised you the most. Was it the potato, the tomato paste, or something else? And tell me in the comments and let me know which 2 or 3 you're actually going to start with this week. I read every single one. If this kind of real, sourced information about eating well after 60 is useful to you, subscribing helps more than you'd think, because it tells me to keep making them. Next week, I want to take a hard look at the everyday drinks quietly working against your blood pressure, including a couple that are marketed as heart healthy. I think that one is going to surprise you even more than this one did. I'll see you there.